So we're in the Diabetes Home for Healthy Living, which is a clinic through USF Health to help patients and families learn to deal with and manage their diabetes. We treat both type 1 and type 2 diabetes, and is a center where the patient can feel a little bit more at home and has more access and convenience, a different model than the traditional clinic. And it's all done in an environment that kind of decentralizes the clinic room. There's areas for the patients to sit and to learn more. A waiting area that's very open and comfortable and encourages a sense of community as part of that diabetes home concept. So I think by coming to this clinic, the patients have an access point that's convenient for them and that's accessible, but also networks within our own group, because we are the largest multi-specialty group in the area, including over 400 specialties. The patients have access to that network if they need specialty services like cardiology or OBGYN or nephrology or ophthalmology to help care for their diabetes.
It's the first of its kind in this area of Florida. So this allows them to come and pick up their dry cleaning, stop and get their lab work done, come and see their provider, get tips on their diet before they go to Panera Bread. And I think it's just easier for them to come in, and they tend to be more motivated to want to help get their diabetes under better control. We have partnered with a company called EOS Health, who provide us with the ability for patients to eventually have a meter that'll work through mobile telecommunication, and their blood sugars will then go directly into their medical record, and we can monitor their sugars 24 hours a day. If they have a low sugar, it'll go to an on-call nurse, and then we can be notified. It just allows patients to have easier access, I think, to their providers to help care for their diabetes.
Well, I was looking for a new doctor's office just because I wanted something more hands-on. I got out of my honeymoon phase, what they call it with diabetes, when you're like really in control and everything's just perfect with it. And then you start to get a little bit more lazy with it. You're not really controlling yourself. You're not really doing what you have to do, your homework for diabetes. And I love it. I really, really like it. I really would suggest all diabetics to come here. She does an awesome job. She's more hands-on. Like, instead of just giving me a prescription and saying, okay, go ahead, she kind of gives me the prescription, tells me exactly what I need to do. She gives me a list of homework to do. And I come back 2 weeks later, and she sees where I'm at, and it's like she's assigning me homework that I have to do, and I get it done, and I feel so much better. Like, I have more energy, I feel healthier, I just overall feel so much better, and I really like it here. It's more homey too.
They have this center that just opened up here, which is right around the corner from my work. It makes it perfect to come here, and I loved it from the moment I walked in. Everybody's so friendly. It's just a real homey atmosphere. You don't feel like it's a doctor-patient relationship at all. You really feel like they care and they're your friends and they want to know what's going on with you and they want your best interest, you know. They're looking out for your best interest and they want you taken care of. I like the point that you come in here, you can get your A1C checked, you can do kind of like one stop, getting all your blood work checked and all. And that, you know, within 2 visits, they had changed my medicine up and got my levels to drop significantly already. So it's like, you know, this is what we're going to try. If it doesn't work, pick up the phone and call us. Let us talk to you. And, you know, and I feel like I have that opportunity. Anytime I have a question, I can call Michelle or Dr. Knox and just talk and feel more comfortable about what I'm doing. So that's what I like about it. I mean, it's really a great facility.
Whether it's type 1 or type 2 diabetes, we recognize that it represents a challenge, but we think really here that we have the tools and the ability to help patients take control and to get control of their blood sugars and improve their health. And we're happy to help anyone that comes through the door.